The social cash transfer is a component of the social protection mechanism which seeks to reduce the vulnerability of low-income households with regards to their consumption as well as access to basic services such as education, health, food, shelter, among others. So since its launch in 2003, the scheme has been rolled out to 574,663 beneficiaries in 80 districts of the country as of 31st December 2017. So the Office of the Auditor General, in accordance with Article 250 of the Constitution of Zambia, the Public Audit Act, as well as the Public Finance Management Act, conducted an audit to assess the efficiency as well as the effectiveness of the social cash transfer program towards the reduction of extreme poverty among beneficiary households. So this audit was conducted between the period of 2014 to 2017, and it was in this audit that various challenges were actually highlighted with regards to the implementation of the social cash transfer. And the first challenge that was reported was that of failure to meet the target. And it was reported that as of 31st December 2017, the program had been rolled out to 80 districts, representing a coverage of 76.9% of the targeted districts. And in this regards, the Ministry of Community Development and Social Services had only reached 574,663 out of the targeted 590,000 beneficiaries, representing a coverage of 97.4%. The second challenge that was reported within the Auditor General's report is that of payments to ineligible beneficiaries, and it was actually noted that the ministry had paid social cash transfers over 2 million kwacha to 2,284 ineligible beneficiaries for the period ranging 2 to 14 months. And during the period under review, ineligible beneficiaries were put on the scheme due to a number of reasons. The first one being wrong targeting by the enumerators, and there's high level of illiteracy as well as lack of timely verification process. So the audit also reviewed the inclusion of uncertified disabled beneficiaries on the scheme, and it was reported that out of a total of 8,508 beneficiaries purported to be disabled, credentials of only 76 beneficiaries were verified, while the balance, 8,482 beneficiaries, had neither a medical certificate nor certification from the Zambia Agency of Persons Living with Disabilities. Another challenge that was highlighted within the Auditor General's report was that to do with the delayment in disbursements of funds. And it was actually reported that the ministry delayed to disperse funds, and this was in the 50 districts selected during the audit. It was noted that payments of transfer amounts to beneficiaries were actually delayed for a period ranging 8 to 332 days. Another challenge that was faced with the implementation of the social cash transfer is that to do with the failure to review transfer amounts to reflect inflation. And the Ministry of Community Development and Social Services did not regularly review the transfer amount in the period under review to reflect inflationary adjustment amounts on an annual basis. And the report reviewed that during the years under review, the transfer amounts to beneficiaries were only reviewed in 2014, from 60 kwacha in 2013 to 70 kwacha in 2014, and that the amount had remained the same as of 2017. The last challenge that has been met with regards to the implementation of the social cash transfer is that to do with high administration costs. And it was reported that contrary to the standard harmonized operation manual that requires that the ministry maintains administration costs at a 15% of the total transfer amount, a total of 63 million was paid to districts above the 15% threshold. Furthermore, between 2014 and 2017, the ministry spent administration costs of over 317 million, which was 40% of the transfer value of 760 million, which is contrary to the grants agreement, which requires that administration costs should not exceed the international rule of thumb of 20% of the transfer value. As a way of ensuring that the objectives of the social cash transfer program achieved, the Office of the Auditor General highlighted various recommendations which the Ministry of Community Development and Social Services ought to take on. And PMRC is in full support of the Auditor General's recommendation. In addition, PMRC has recommended measures to ensure that the AG's recommendations are achieved. So the first Auditor General's recommendation that was given was that to ensure that only eligible beneficiaries as per set beneficiary selection criteria benefit from the program by strengthening the selection process, which includes identification, enumeration and validation, and also ensuring that verification of beneficiaries is done before payment commences. As PMRC, our recommended measures to ensure that this is done include the following. As PMRC, we recommend that there's need for intensive data cleaning to curb the duplication of national registration cards. PMRC recommends that there's need for continuous validation to reduce on ghost beneficiaries as well as households in which the beneficiaries are deceased. Then PMRC also recommends that there's need for the digitalization of the selection process in order to deal with ineligible individuals who want to be on the scheme and are not eligible to be on the scheme. Secondly, the Auditor General's Office had recommended that there's need to improve collaboration with the Zambia Agency for Persons with Disabilities to develop a more rigorous framework for identification, verification and certification of disabled beneficiaries so that the correct and deserving beneficiaries benefit from the program. And for PMRC, we've actually put up the following measures that need to be done in order for the ministry to achieve this recommendation. The first being that there's need for a memorandum of understanding to be signed with terms of reference to outline the role of the Zambia Agency for Persons with Disabilities. Then PMRC also urges government to increase funding for the Zambia Zambia Agency for Persons with Disabilities in order to increase capacity of the officers responsible for identification, verification and certification of eligible beneficiaries. Alternatively, the Ministry of Community Development and Social Services could ensure that synergies and partnerships are formed with ministries that have presence in all districts in order to enable the Zambia Agency for Persons with Disabilities to utilize the offices for the administration of the social cash transfer. The third recommendation that the Auditor General had put forward was that to ensure that administration costs are kept to the minimum as per the ministry's on-set target of 15% in the harmonized manual of operation for social cash transfers. And we as PMRC actually would like to urge government to consider utilizing mobile phone technology, which has various financial platforms such as mobile money. So mobile phone penetration has increased over the years and therefore presents an opportunity for the administration of the social cash transfer program, and this will help cut on some of the administration costs as well as eliminate the duplication of beneficiaries. Secondly, PMRC would like to recommend that controlling officers should look into finding different streams of funding for administration costs by applying for calls of proposals. And lastly, we as PMRC feel that there's need for a contingency budget that should supplement administration costs. Lastly, the Auditor General's Office recommended that there's need to implement measures to ensure that the transfers from the Treasury are made in a timely and consistent manner in order to avoid a trickle-down effect of delayed payments to provinces, districts, and ultimately to beneficiaries. And as a way of achieving this recommendation, PMRC proposes that controlling officers must develop a rigorous follow-up system on funding, ensuring that funds are received on time. Secondly, PMRC would recommend that reports on the impact of the social cash transfer must be shared with senior government officials from the Treasury so that they're informed on the benefits of the scheme as well as the effects of delayed funding on the improving the livelihoods of beneficiaries, which we encourage them to prioritize and dispense funding on time.